Hi, my name's Lorena Oberg and I specialize in removal of permanent makeup. I felt compelled to make a video today because more and more I'm seeing through my practice migration of eyeliner. This is when the pigment runs underneath the skin to create that smudgy type look. Usually happens in the edges, or it can happen in this area, but or sometimes I see it almost looks like an eyeshadow on top of the eyeliner. The one thing that I've been noticing is happening is that a lot of these eyeliners are coming from either carbon inks, which are permanent inks to be used on the body, or there is also a permanent ink brand that has been deemed safe to use on the face, and this permanent brand seems to be giving us a lot of these migration issues. The other thing is perhaps the needle choice. The older generation of permanent makeup artists tends to do eyeliners with quite thick needles, which protect you from color migration. One of the sad things is that a lot of these color migrations are starting to come to me in funky colors. And what I mean by funky colors are anything that is a color that I can't remove is a funky color. And what I always say to the technicians is, listen, I'm your insurance policy. If anything happens, you want to make sure that you can call me and tell me and ask me to take it off. I take off migration very easily with lasers, and it's maybe a 2-3 treatment procedure at the most. It tends to come out very easily. But if you use funky colors, which are your greens, your blues, I'm not talking about a black that went blue over time or that went blue when it migrated. I'm talking about a proper like sky blue that used to be really, really popular, and it seems to be coming back again. If you're using these colors, if you're using your bright blues, if you're using your greens, darling, I will not be able to help you. So see me as your insurance policy, but make sure you're using colors that I can actually help you with. If any migration is something that will happen to all technicians at some point, doesn't matter how many years you've been in the industry. I've taken migration of people that have had very, very experienced technicians that have been in the industry for 15, 20 years. And their story is always the same. They call me, they say, Lorena, I can't believe this has happened. It's the first time it's happened. I don't know what happened. I must have hit something. Generally, it happens in older patients that have very thin skin. But listen, it can happen to anyone. And sometimes it's just one of those things. So I beg you, don't use funky colors. Don't use the bright blues. Don't use the greens. And certainly, if it does happen to you, the worst thing you can do is cover it up with skin color pigment, because that's nearly impossible to get out. And even if they come to me, and I'm good at getting ink out of the skin, flesh color pigment, I need to go in with non-laser methods that are very aggressive, have a much higher rate of scarring. The best thing to do is to find somebody in your area. If you're watching this video from not from England but from America or other places, find someone in your area that does removal of eyeliner. If you don't, in America, there's several people that I've trained. If you don't have anyone in your area, I do train the technique. Find a laser technician, find a doctor that does tattoo removal. They already have the equipment. All they need to do is have the training so that they can deliver these sort of treatments. And these are people, of course, that are getting these phone calls daily. Can you remove eyebrows? Can you remove eyeliner? And they just simply don't have the skills. So by all means, if there's no one in your area, make sure that they know about me. Make sure that they know that I train in America, I train in Europe, and I train in the Middle East. So to see what my movements are at the time. But if you are a technician and you're watching this, the fact is that please just use black. Don't use any other colors. If you are a patient that this has happened to, provided provided that the eyeliner started out as black, it is a relatively simple procedure. So don't panic. But you must have someone that has experience at removing permanent makeup from the periorbital area, so the eye area. You want to make sure that it's somebody that's very, very experienced in removing from this area. If you have any questions, you can write them in the comments, and I do my best to get back to everyone.